of the day. Look, my husband doesn't have a hat on. And the wind chill is in the 50s. He'd still usually wear a hat, especially because it's windy. You smell that? We're going to that restaurant. Takeout. Okay. So, one thing I wanted to mention. You're given a lot of medications. A lot of medications I couldn't remember. When I was lying there, is it laying or lying? That's my weakness. Laying there, they would give you they give me an antibiotic. They would give me, it's going to be a dog bark fest coming up here. You're laying there and they're giving you medicine after medicine. This is pre-surgery. You have to pretty much wash your body with antibacterial. So for 2 weeks, you have to do this medicine in your nose, and that's all pre-surgery. I mean, that's like 2 weeks, and then you get into the hospital. You have to take a shower before you go to the hospital. You have to then go wash your body with these special antibacterial preloaded wipes. Well, anyway, I was in the hospital. This is my first surgery for my hip, and I've had a lot of surgeries. This is the first time this has ever happened to me, where they're giving me medicines, and all of a sudden I was just watching TV, and I said to myself, oh, I don't think I want to do this. I don't think I want to go through with this surgery. I don't think I want to do this. I think I should just go home right now and forget about the whole thing. I don't know did I mention anything to you?
Oh yeah.
I did?
Yeah.
I said, I don't know if I want to do this. I did. So I couldn't remember if I did or not, but I really did not want to do this. I thought I was going to get up and leave. But I mean, you're like strapped in and everything. I mean, you can tell the nurse you don't want to do it. But the reason that happened is because they injected me with a steroid to help healing. Now, that is optional. I told the doctor afterwards that, I started freaking out right before, because I was like, go for surgery. And then I was like, no. Well, anyway, he didn't really care that I told him that in the hospital room. But when I had my surgery a week after my surgical appointment, I told his physician's assistant that I was having trouble with one of the medications. And so she said, oh yeah, some people have that. It's the steroid. And we don't have to give that to you. And I said, no, you can give it to me. I just didn't know what was happening to me. But he said I was freaking out a lot.
You succeeded?
What are we doing right now?
So you succeeded in giving homework?
Oh, they're already done. We were walking to the school to get it's like almost 6 o'clock on a Friday night. We're walking to the school, so they're already done. Anyway.
I hurt myself right here.
You hurt yourself.
In the nuts.
And they're
trying to go off.
And they're all talking about
Pokemon.
Pokemon out there.
You can edit that out.
You can, but then that's something
I may not.
said.
So,
Daddy.
see you soon.
Use crutches, use the roller walker,
Yeah.
use the hand grip things to reach down.
Oh, yeah, those are cool. Okay.
Yeah.
So I'm going to talk about some of the things I used while I was, I would say, going downhill. We're out here today. I'm still happy to be out here because it means I'm walking and it's crappy weather. It's going to be crappy all day though, so we had to pick a time and just go. So hopefully we'll get 2 walks in at least. Anyway, I want to talk to you about some of the things that I used to adapt my environment to make things easier for me so I didn't lose or get in so much pain and lose energy. So one of the things I used for laundry was just a regular walker, and it happened to fit the size of my
Not a
basket.
regular walker.
Roller walker. I don't know what you
Roller
call it. Yeah.
with
Not,
brakes
yeah.
and-
One of those, yeah, with brakes that you can sit down on. But I put my laundry on that and use that. I had 3 of them at one time, but now I only have 2. So it's just kind of like a laundry cart, and that really, really helped me be able to do laundry when nobody was around to carry it. Another thing is to use those, I don't know, I get them at the Dollar Tree, but I know there's more expensive ones. They're pinchers, so you can pick up things on the floor. It kind of amazes me that I could even pick up like a marble on the floor. Since my kids leave a lot of things around, I was using that a lot. So what else did I use? Because I was struggling to do ADLs. I had to sit down in between doing laundry and dishwasher. So I was struggling to do a lot of those things to be productive.
Shower seat,
Oh yeah, shower seat.
riser.
Yeah, the toilet riser, and I didn't have like a railing near the toilet, so I used a stabilizer there. Definitely a toilet riser. You know, nobody really wants to use these things, but just use them. I mean, I went through a time where, and I can talk about this on a video, where I was embarrassed or, you know, didn't want to use these things. They make me feel old. They make me feel like my disability is very public, you know, because sometimes I can get by without looking fine, using the elevator, things like that.
The wheeled carts in Walmart, Target, that type of place.
Oh yeah. Once in a while I would have to use the electronic carts. And I was afraid I was going to take one for somebody else in a worse condition, but the worker at Menards was like, you don't know when somebody else is going to come in, so just use it. If you need it, use it. And I was like, yeah, I do need it. I know I don't look like it, but I do need it. So I'm sure there's other things. What kind of things do you use to make your environment better? I mean, there's no reason to be in pain if there's a solution. I mean, what I'd like to say is just don't be too proud. Just use what you need to use. You know, railings, funny little things like that. But it's important to do that to keep yourself out of pain. They're my kids. Hi. See you later. How many blocks away are we from?
cautious about that car was coming from.
Good job, kitty. Oh, there she goes.